Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about lipid insoluble beta blockers. So if you see lipid insoluble beta blockers, they do not cross blood-brain barrier and thus there is no CNS effects. They have good renal excretion. They have no membrane stabilizing activity. Then they are incompletely absorbed orally. They are incompletely absorbed orally. These lipid soluble beta blockers are long acting and they are effective in narrow dose range. Okay, thank you for watching.
Thank you and thank you for watching.